Alien hand syndrome is a rare neurological condition that causes one hand to act on its own free will. Sometimes one leg is affected, though this isn't as common. With alien hand syndrome, the hand isn't under the control of the mind and moves as though it has its own mind. The affected hand feels foreign to its owner during these episodes and seems to move deliberately to carry out tasks that are unintentional. Alien hand syndrome can be caused by several factors. Some people develop alien hand syndrome after a stroke, trauma, or tumor. It's sometimes associated with cancer, neurodegenerative diseases, and brain aneurysms. Alien hand syndrome is linked to brain surgeries that separate the two hemispheres of the brain. This may involve an incision along the corpus callosum. The corpus callosum divides the brain hemispheres and allows for communication between the two sides. Surgeries to treat epilepsy sometimes affect the brain in this way. The most prominent symptom of alien hand syndrome is the inability to control the hand as it acts independently. The affected hand may move involuntarily and perform goal-directed tasks and actions. The hand is said to move without cognitive control or awareness. It's as though it's being controlled by someone else or has a mind of its own. The hand may touch your face, button a shirt, or pick up an object, sometimes repeatedly or compulsively. The alien hand may also levitate on its own. A doctor may diagnose alien hand syndrome through observation and evaluation. Diagnosing alien hand syndrome is complicated because it's a neurological disorder that lacks a psychiatric component. This makes it more difficult to diagnose because behavioral issues are more common than alien hand syndrome. Treatment for alien hand syndrome varies depending on the underlying cause of the condition. If it's caused by a tumor or other growth in the brain, surgery may be necessary to remove it. If it's caused by a stroke or other brain injury, rehabilitation therapy may be helpful in regaining control over the affected limb. In conclusion, alien hand syndrome is a rare neurological condition that causes one hand to act on its own free will without conscious control over its actions. It can be caused by several factors such as stroke, trauma, tumor or brain surgeries that separate the two hemispheres of the brain. Diagnosis can be complicated due to its neurological nature and treatment varies depending on the underlying cause of the condition. Thanks for watching Mind Incognito. Please consider subscribing.